As we've moved through these clinics in our centers, we've gotten several questions from team members that may have not been vaccinated the first round. If you want to get it at the second round, we absolutely encourage it. We'll have 3 total clinics. The important thing is to get 2 vaccines. You need the initial vaccine and then the booster. But we do encourage folks to get vaccinated at any point. And if you miss the first round, it's okay. We can still do it on the second and third round.
And as far as receiving the second dose, the recommendation is a minimum of 21 days for the Pfizer vaccine. It is acceptable 4 days prior as well, and that is a minimum of 21 days. So if it expands a little bit further with the scheduling of the second clinic, that's acceptable as well. 28 days on the Moderna vaccine has also been the recommendation, included in the emergency use authorization.
So I'd like to address the rollout of the vaccinations in our setting in long-term care and then what we've maybe seen on the news. We have not been negatively impacted during the initial vaccine rollout. All of our clinics that have been scheduled have occurred on the date scheduled. All of our residents that have wanted a vaccine, all of our team members that have wanted vaccines were able to receive them.
We've had success working with our pharmacy partners, so we want to thank them. There have been a couple of states where there was some state recommendations and rollout within the state, but majority through our CVS partnership. So we want to thank CVS for being such a great partner and working with us in our individual facilities. So we've been getting a lot of questions about, is this safe in pregnancy? And our recommendation is to reach out to your primary care or your OBGYN if there's questions about pregnancy, just to get an understanding, but really look at the risk versus the benefits, those that are with direct care and the risk of getting COVID. You want to protect yourself as much as possible, but we do encourage you to have that conversation with your doctor.
And in addition to pregnancy, we've gotten other questions specifically around somebody's individual needs or individual health conditions. The only current contraindication for this vaccine is previous known allergy to the vaccine or the components. There are no other contraindications based on health history or health conditions, but if there are any concerns, we encourage you to have those conversations with your healthcare team.
We've been getting a lot of questions also, and in the news, we've been hearing about the variant strain of COVID. So with that said, this vaccine does support coverage, but there's more information to be shared.
Historically, all viruses mutate over time. There's a UK variant, there's a South African variant, and now there are new reports that there may be a United States variant. We expected mutation with this virus. What we also expect is the current vaccines available should still cover all current mutations of the virus. And frankly, the virus hasn't had enough time to mutate enough to where these vaccines would be ineffective. Now that could mean down the road, we may need to do another booster as this virus mutates. And think of it like the flu vaccine. We slightly alter that vaccination every year to meet the current mutations of that virus. So we get questions around availability of vaccine in the future. It's important to know that right now with the Federal Pharmacy Partnership, we will have 3 clinics in every center that we support to vaccinate new hires and vaccinate new admissions. We want you to have confidence when you receive this vaccine. We want you to feel comfortable with the decision to receive this vaccine. The only listed contraindications for the vaccine at this time are allergic responses or known allergies to the components of the vaccine. That being said, if you have a specific health condition that you're worried about, conversations should be had with your primary care about what the right decision is for you.